right, I think we can go ahead and get started. Welcome everyone. Good afternoon. Thank you so much for joining. My name is Gabby Draper. I am Director of Advocacy and Policy for Derma Care Access Network, and I'm excited to invite you to this webinar today to talk about misclassification in dermatologic care and coverage inconsistencies that we see as a result, as well as some policy solutions we can consider as we try to tackle this issue. So briefly, I'll share a little bit about DCAN, Derma Care Access Network, or DCAN. We are a national coalition of a little more than 24 advocacy organizations. We represent patients, providers, and other skin stakeholders working to raise awareness of and inform policies impacting patient-centered care for individuals living with skin conditions. So DCAN, we advocate at the federal level, the state level, as well as directly with health plans to ensure that, any barriers that we see impacting timely access to quality care for patients, we can help to address those. So here's just an overview of our membership. As you can see, we have quite the spread of organizations, and we really work to engage our members in any way possible, whether it's through discussions like these, sign-on letters, roundtables, and other public forums, just to help collaborate with others in the space and kind of bounce ideas off of each other to see how we can really advocate for the skin community as a whole. So today we're going to really explore the burden of disease, specifically for vitiligo and alopecia areata. I have quite the panel today, and I will go ahead and introduce everyone and then kick it off to you all. So today we have three wonderful panelists representing the patient and the provider community, as well as the advocacy community. So first, I'd love to introduce you all to Natalie Mamero. Natalie was diagnosed with alopecia areata in high school, and this later progressed to alopecia universalis. After many years of shame, guilt, and utterly acceptance, Natalie embraced her baldness. As a dedicated advocate, Natalie has spent over a decade volunteering with the National Alopecia Areata Foundation's Legislative Liaison Program, advocating on Capitol Hill for legislative changes that benefit those with alopecia. Currently, Natalie serves as Director of Community Engagement for the Coalition of Skin Diseases, supporting individuals with skin conditions. She is passionate about ensuring that no one feels alone in their journey and is committed to creating positive change through advocacy. Next up, we have Alicia Archibald. Alicia is a Georgia native known for her vibrant spirit and passion living life fully. Diagnosed with vitiligo in 2015, Alicia turned her frustration into purpose and became her own advocate. That determination ultimately led to the creation of So Rare They Stare Incorporated, a Southeast Georgia-based nonprofit organization dedicated to raising vitiligo awareness. Established in 2018, So Rare They Stare is committed to its mission to educate, encourage, and empower individuals affected by vitiligo. Through her leadership as founder and president, Alicia uses her platform to raise awareness and share knowledge with communities locally, nationally, and internationally. Beyond her work with So Rare They Stare, Alicia serves as vice president of the Vitiligo International Patient Organization Committee, or VIPOC. She is a board member for the Global Vitiligo Foundation and co-chairs Unite, a virtual support community program created by the Global Vitiligo Foundation. Alicia's advocacy has been featured across multiple platforms, including The Portia Brunner Show, WebMD, Self Magazine, GIF TV's Faces of Vitiligo documentary, and the first ever FDA patient-focused drug development meeting. Through her work, Alicia continues to amplify the voices of those living with vitiligo while inspiring others to embrace their uniqueness and live boldly. And finally, I would love to introduce you all to Dr. Peter Leo. Peter Leo, MD, is a clinical assistant professor of dermatology and pediatrics at Northwestern University. Dr. Leo received his medical degree from Harvard Medical School and his dermatology training at Harvard. While at Harvard, Dr. Leo received formal training in acupuncture. Dr. Leo is the founding director of the Chicago Integrative Eczema Center, a founding faculty member of the Integrative Dermatology Certificate Program, a founding member of the Skin Angels Advising and Investing Network, and a member of DCAN's Medical Advisory Board. He has over 400 publications and 5 textbooks. So thank you all so much for being here. Now I will pass it over to Dr. Leo and really just want to start off with a brief overview of the burden of vitiligo and alopecia areata, and then, foster a conversation with our patients here today. So Dr. Leo, the floor is yours.
Thank you. And thanks everybody for joining us today. This is such an important topic because one of the problems with these two conditions is that they both cause a whole great deal of trouble for our patients and their families. But there's this kind of aspect where they can be a slap in the face where people will dismiss them as not dangerous or even just cosmetic. And it's really, really stressful. In dermatology, a lot of what we treat is on the skin by definition. Now, some of our conditions also have systemic issues as well. Some people have also stuff going on with their bowels or with their joints or in their nervous system. But fortunately, for the most part, vitiligo and alopecia areata tend to be just limited to the skin, hair, and nails. That said, they still cause a huge impact on people. So they're both autoimmune conditions. In fact, sometimes they run together. I have some patients who have both at once. It's actually not that uncommon to see an overlap. And what was happening in these conditions is that the immune system has, for reasons we don't fully understand, decided to attack the person itself, right? So our immune system is supposed to protect us from things that are not part of us, but keep respect for our own body. But here, with the case of alopecia areata, the immune system starts to attack the hair stem cells where our hairs grow and it damages them, and then the hair cannot grow anymore. So by attacking this area, people lose their hair and then they have very smooth skin where the hair should be. Typically, if we can control that inflammation and kind of tell the immune system, settle down, the hairs will grow back. But sometimes, if it's been a very long time, some patients really are not able to ever grow that hair again, which is pretty frightening. Now, if it's a tiny patch, it might not seem like much, but for a patient, it can be a very visible reminder of something that is not quite right. And for people in society, they can see patients with little patches of hair loss and be worried, is this something contagious? Is there something weird about this? But of course, some patients can lose all of their hair, not only on their scalp, but sometimes throughout their whole body. And if you lose it throughout your whole body, there are some real issues that can happen. Your eyes, it turns out our eyelashes are there for a reason. Mother Nature put them there for an important reason, and they're to help keep our eyes protected. If you lose that, you can actually have more prone to irritation and getting stuff in your eyes. Of course, our nose, we have some nose hairs. Many people trim their nose hairs. They don't want it to be unsightly, but they also serve a purpose. So those can also fall out. So there's a whole set of issues with alopecia areata. Vitiligo, similarly, there's an attack on the pigment cells, the melanin producing cells called melanocytes in our skin. And again, you might think, well, it's just a cosmetic thing, but no, melanin's really important. It not only protects us from sun damage and ultraviolet damage, but when you have splotchy pigmentation on your skin, again, it can be a sign that something's not right. People can look very, very strange to others, and you'll hear today, people often are discriminated against. Everyone steps away from them at a bus stop. People will take pictures. I've had patients over the years who say, it was so humiliating. All these people started taking pictures of me because of my vitiligo. And while there's nothing necessarily dangerous about it by itself, patients sometimes have sunburn in those areas and actually have a higher rate of skin cancer in those areas. So these are really tough problems. And I'm happy to say that finally, after basically the entire history of modern medicine, we've had no approved treatments for either of these conditions until just the last couple of years. Finally, we actually have the FDA approving a couple of treatments that we can now say, okay, this has actually been studied and we can actually use this. But despite that fact, and I can tell you this, I am literally in the trenches, even though they are the very few things we have approved, I still have to fight for those medications for patients all the time. And it's so stressful. The patient is so excited to hear that there's something there. We write the prescription, we go over the risks and benefits, we do all the paperwork, and then the insurance company says, nope. No, we're not going to cover it. It's too expensive, or you're going to have to show more. You're going to have to do more. And once in a while, it wouldn't be such a big deal. But you can imagine this for me, it's my entire life is just everything is a once in a while, but it becomes every patient. And for the patient, they're devastated. They're like, wait, when do I get to start this? I thought I was going to start this. 1 month passes, 2 month passes, all these kinds of things. So you can imagine all of the dynamics here. And I think the purpose of today really is to talk about that for anybody who's not convinced. We want to make sure you can hear the impact, but also to really push the idea that we're trying to do the right thing. There's nobody here trying to do stuff for fun or trying to steal anything or trying to do something just for a cosmetic purpose and trying to get insurance to pay for it. Absolutely not, right? These are people that really they're just trying to get back to where they were. This is something that has taken something from them, quite literally, pigmentation and hair, and we're trying to help put that back. And that's really all there is to it. I'd love to turn it over to Alicia. Can you tell us a little bit about your story and living with vitiligo and how it's been impactful for your day-to-day life?
Yes, thank you so much, Dr. Leo, and thank you, Gabby, for this opportunity to share some of my story. Um, it has been challenging for me living with vitiligo now. This is my 12th year living with vitiligo. I was diagnosed officially diagnosed in 2015 with vitiligo. Um, of course, it was scary. I had seen it, but didn't quite know what it was. But to just to elaborate on my story, I had a grandmother who had vitiligo. So I knew what it was. I just didn't know, I didn't have a name to it. But I was afraid because I simply just didn't know enough about it. My challenges that I have faced, that's just the short part of the story, but the challenges that I have faced. I work in a public arena, so I'm constantly faced with people, as you were just saying, Dr. Leo, people looking like what's wrong with her, what's going on with her skin. As you can see today, my face is pretty much depigmented, but my face over the years, I've faced the stares because I had blotchy skin. I had different colors, even though I was one color, as my vitiligo was spreading, I was different colors. So I've had to face the challenges of the stares, but people asking, did you get sunburned or did you get, I'm sorry, did you get burned by an iron? Were you in a fire? Or I've been asked, hey, is that a chemical burn? So it's been very challenging living day to day with vitiligo. And now that my face is pretty much depigmented and pretty much all of what people can see with my skin, um, I face people asking, what race are you? Even people asking, what are you? So that the first time I heard that question, that was really hard. What are you? And, I got defensive and I'm like, what do you mean? What am I? So the challenges that I face are pretty much the stares. It doesn't affect me as much now because I've turned that pain and those stares into just being my own advocate. And that I wanted to become an advocate, not just for myself, but for others, because I want people to understand what vitiligo is and to speak up for those who are not at a place where I am or at a place where I was when my vitiligo started, when I was afraid to speak up or just didn't know how to answer the question. So so that's pretty much my daily challenges with vitiligo.
Thank you so much. Natalie, can you tell us a little bit about your story and how it has been day-to-day living with the alopecia?
Sure, thank you. And I want to say, Dr. Leo, you were right on point about the eyelashes and the nose hair. And that's something people don't think of. I wear fake eyelashes now, in part because I think they're cute, but actually largely because it keeps stuff out of my eyes. And I have to put eye drops in my eyes twice a day because they are so sensitive. So that's like a great point that people don't think of is your eyelashes and your nose hair really does play a role in protecting your body. And without them, it becomes evident very quickly. So I started losing my hair, patchy hair loss when I was in high school, which is, it's always a tough time for that to happen, but it felt like an especially tough time as a young woman. And I had patchy hair loss for about 8 years. And this was really sort of pre-internet, pre-Instagram. I didn't know anyone that had alopecia until 8 years into my journey. It was a very lonely road to walk by myself. There was a lot of denial, a lot of shame. What am I doing wrong? Um, and then I lost all of my hair in 2009. Every hair on my body just boop, kaput within a month or two. And I think for me, once I lost all of my hair, I sort of was faced with having to accept it. Like there was no more kind of hiding. And that really for me was a turning point in my journey of acceptance. I have wigs that I wear here and there, but as I've gotten older, I'm almost 40 now, I just don't wear them as much because this is who I am. And I've very much accepted it, but so much of what I do now is my goal really in life is to make sure that other people, but especially young people, know that they're not alone. They know that you can be happy and successful despite these challenges. Having alopecia has certainly made me a more empathetic person. I definitely wouldn't be who I am today without it. There are days that I actually miss my eyelashes. I don't miss my head hair that much because my wigs are pretty great. Um, but I really miss my eyelashes, to be honest. And there are days I don't want to go out into the world without my wigs. Sometimes I do just want to fit in. So there's a huge mental component to it. Even for people who've sort of accepted their journey, it's always there. It doesn't go away. I have several other autoimmune conditions. There's a lot of comorbidities. So I also have Hashimoto's hypothyroidism, and I think I have rheumatoid arthritis, but I've been struggling to get that diagnosed. I've seen a rheumatologist and just sort of a lot of all body inflammation that is painful, and it impacts my physical and mental health, having kind of this constant inflammation in my body. So I'm actually working through that now and trying to find some solutions. But that's my story, and I'm really happy to be here and hopefully to let other people know that you can lead a happy, successful, really fulfilled life, even if you look a little bit different. And it can make you kind of a better person, I hope, I think. Thank you.
Thank you so much. I'd love to hear a little bit about So Rare They Stare and the Coalition of Skin Diseases and that experience. Alicia, will you start us off?
Yes, I'd love to talk about that. That's my baby. Um, so Where They Stare was birthed out of a place of struggle and frustration. Um, I, for me, when my vitiligo started, of course, that fear came, and I had the doctor diagnose it. No, before diagnosing it, I knew, again, as I said earlier, I knew what it was, but just didn't know enough about the disease. So I finally decided to go to a dermatologist and um, get my official diagnosis. But that doctor just pretty much handed me a bunch of pamphlets and told me about a couple of treatments that I could try. And so we started with just a few medications, and I was coming back monthly. Well, I started to see some pigment come back, but within 3 months, she told me I needed to wait because it could cause me to have liver and kidney damage. So from that, I was even more frustrated. And so from there, just my frustrations, I decided to become my own advocate. That's where the my organization the name came from. So rare they stare. So rare because less than 1 to 2% of us have vitiligo. And they stare. I originally started saying they stare because they don't know what it is. And that is true. But I say they stare because we're beautiful. Same with alopecia. We're beautiful. We're different. Um, I heard Natalie mention sometimes you want to fit in, but vitiligo makes us stand out. Alopecia makes us stand out. So whether we want to or not, we stand out. So my mission with So Rare They Stare, educate, encourage, and empower. We really try to live that mission out with every person that we touch. Um, I leave myself open. That's what all of us inside of the organization do. We try to make sure we encourage those with vitiligo because I know the challenges that I faced, and I don't want others to be alone in this journey. Empowering them with knowledge. So I attend lots of conferences, even participated with Coalition of Skin Diseases, and go to the Hill and advocate for those of us with various skin diseases. But So Where They Stare uses that information to go back out into my local community and empower others with with the knowledge that I've gained. So when you know what it is that you have, you can speak and be able to tell someone, and then you're emboldened. And then I think that helps remove some of the stigmas that are attached to vitiligo and empowering, as I said, empowering you. Once you have all of that, once you've been encouraged, once you've been educated, then you're empowered. And so that makes you a better patient, that makes you a better advocate to go out and speak for yourself. So a panel like this to be able to speak to others and to let you know how the psychological impacts of those of us with vitiligo. Although it doesn't harm us, there are a bunch of psychological stigmas and impacts with us, those of us with vitiligo, that we face every day. So using that platform, every platform that we have, So Where They Stare, to go back out and educate people and let them know how they can help us with this fight and help us one day come up with a cure. There's so many new things out there now. We're so excited with the things that are happening now, and definitely want our lawmakers to join in with us to help us move things along and move things forward for vitiligo.
Thank you, Natalie. Will you tell us your story about the coalition?
Sure. Yeah, the Coalition of Skin Diseases, we advocate for the 84, we think it's actually quite a bit more than 84 million people, but 84 million Americans with a skin disease. That's 1 in 4 Americans. We think the number's closer actually to 1 in 3. And we are comprised of 38 patient advocacy organizations that span the skin disease spectrum. So we represent skin disease patients, whatever your skin disease may be. And our goal is to use our voice together because it's much stronger when we speak together to our policymakers and our folks in charge of regulations than if we, speak just as our own small group. So we really want to raise the voice of patients and make sure that policymakers and the public are educated and aware of these diseases. If you don't know what alopecia is or what vitiligo is, how can you make policy change about it, right? Half of the battle is bringing awareness to our diseases to the people working in Congress and at agencies. And so that's the CSD, and I have been with the CSD for about a year and a half. We every May hold a large fly-in where we fly between 60 and 80 patient advocates from all around the country into Washington, D.C. We spend 3 days teaching our advocates how to tell their story in a way that's really impactful, and also teaching them the policy issues and legislation that we care about that would positively impact those of us with skin disease. And a lot of what Alicia said, I think is so true, and that it's incredibly empowering for people to tell their story, even though it's very difficult. I struggle a lot with kind of the loss of control of having alopecia. I feel like my body is sort of out to get me. And I'm always wondering, like, when's the next shoe going to drop, right? Like, I have no control over this. And it makes me sort of grab control in other parts of my life, kind of subconsciously without realizing it. So to have people on Capitol Hill that may feel really out of control of their skin disease situation be able to grab that control back, tell their story, ask for policy change. It is such a life-changing experience, and it just gives me chills even thinking about it. And I just encourage everyone, if you haven't been on Capitol Hill or at your state capitol, really encourage you to get involved that way because it's truly a life-changing experience.
Amazing. Thank you both. You guys are so good at telling this story and conveying the gravity of all of this. We know that the treatment platform we had has been incredibly limited. The landscape has been very, very much things we've pulled from other conditions. So systemic corticosteroids, immunosuppressants, light therapy, topical steroids, injectable steroids, but nothing was really a great fit for this. And they all have all sorts of potential side effects and issues, and they're really imperfect. But finally, we have a few things. For vitiligo, we have one thing that's approved. It's a topical JAK inhibitor cream, Janus kinase inhibitor, which is pretty nice, and that's approved that we can use this, and it definitely has some positive data. Obviously, there's some limitations on how much body surface area we can use it. Technically, you can only use it up to about 10% of body surface area, so it's sort of limited, but it can be very helpful for some patients. And if they have more vitiligo than that, it can be a little tricky, but that's one thing. And then for alopecia areata, we now actually have three oral JAK inhibitors, so the same family, but they're this time by mouth. Now, these are powerful medicines. I've seen wonderful effect for these as well. The biggest issue with these is they require blood monitoring. They also have a huge potential list of side effects. Fortunately, most of our patients do really well, but the side effect list can be a little bit scary. And I just point that out just because it's one of those things where there's zero risk of anybody taking it for fun or trying to abuse it. I mean, these are serious medications, and I just want to just push that because I often feel like the insurance companies grilling me as if I'm trying to do something like get free toxin to give somebody wrinkles or something. It's like, golly, this is serious stuff. The patient has to come back every couple months to do blood work. And even the topical, even though it's pretty darn safe, you should read the prescribing information and what the patient looks at. It's very scary. It has the same list of side effects, major adverse cardiovascular events. It talks about malignancy. So cancer is on the thing when you look at it. Again, we think these risks are low, but because of the mechanism of action. So I'll ask you both, have you guys had some struggles getting treatments covered? What kinds of things have you experienced in this domain?
Yeah, I'm happy to start. So when I first was diagnosed with alopecia, there were no JAK inhibitors. The only thing I had were cortisone shots into my scalp, which let me tell you, do not recommend. 0 out of 10. Very painful, did not work. Went the prednisone route for a while. That actually made the situation worse. So I didn't really have a choice. I think it's fantastic that people being diagnosed now with alopecia have the option of taking a JAK inhibitor. I have struggled my entire life getting insurance coverage for my wigs. I think people don't understand the cost of a wig. My wigs are about $6,000 each. I've had seven of them since 2009. So you do the math. That's like a small, it's like a sedan that's sitting in my in my closet at home. And these are what I try to do in my work with the National Alopecia Areata Foundation is meet with members of Congress and their staff and let them know that this is not cosmetic. Insurance absolutely should be covering the cost of our wigs. There's really nothing I love more than going into a congressional office with one of my wigs and telling my story and then ripping my wig off and showing them my bald head and seeing kind of the like discomfort, which quite frankly, like you should be uncomfortable by the situation that insurance is not covering it. Um, and so that's what I've struggled with. I've never had a single penny paid for any of my wigs. And again, I now am at the place in my life where I don't necessarily need them. I've accepted who I am. But if I was a young person, if I had lost all my hair at 14, my goodness, I would have needed a wig in order to be a functioning human in society, especially as a young woman. So I just can't stress enough, especially I wish our insurance companies would understand. Like you said, Dr. Leo, we're not doing this for fun. We need this to function as people in society. So that's my story, and I'll let Alicia take it from here.
So for me, similar to Natalie, when my vitiligo started, there weren't any JAK inhibitors, and it was exploratory. A lot of the doctors, and I hear this from other patients who have had vitiligo for years now, before the cream that you mentioned, Opzelura, the brand name that's attached to it, before that came about, there weren't any, and so a lot of us feel like guinea pigs. I've heard lots of people say how, the doctor, put them in this, they had doctors just probing their body. But for me, it was just a variety of medications. And it's like, well, let's try this and let's see how this is going to work. And I also have this, let's try this. Those pamphlets that I mentioned earlier that the doctor presented to me, you know, I'm sitting there and, I'm like, okay, so what do I do with this? So that was discouraging for me. I've always felt like I had control over my life. So, as Natalie mentioned, not feeling like you have control, that's exactly how I have always felt and still feel with vitiligo. Um, with my pigment daily leaving me, I would get up, especially in the beginning, and I can feel myself about to cry. But I remember when I began to lose my pigment, every single morning I would wake up and go and look in the mirror to see, what new spots did I have? Because when my vitiligo started, I started with one spot at the top of my forehead. So for me, I would go and look and see, well, has the spot spreaded? Do I have new spots? So not having that control, not having a doctor that could give me concrete answers. And I always like facts. So when my doctor really couldn't give me concrete answers and concrete, say, hey, Alicia, take this medicine. This is going to bring your pigment back, or this is going to stop. Um, that was really hard for me. So imagine me as an adult thinking that, I'm at a place in my life, my husband and I can just sail and, live a life. I have an adult child now. I'm thinking that I'm living the path that I had chosen. Definitely vitiligo changed that. So the challenges that I face was just not having the correct medication. And the one that I was on, her telling me that it could affect my kidneys and my liver. So that made me say immediately, okay, let's just stop. You're telling me there's no cure. And my insurance company is telling me, I don't know if we're going to visit this a little bit later in the conversation, but my doctor telling me, well, we got to try this first. And I'm like, okay, so what else is there? She told me about the medication that a lot of people look at and say, and I don't have the name in front of me, but the medication that Michael Jackson took, and I'm sure Dr. Leo, you know the name of it, but to go ahead and take all of the pigmentation away from his skin because of the stares that we get. So, me trying to decide, is that something that I really want to do? What is this going to do to my body? What is this medication going to do? So, just the challenges of not knowing, of knowing at that time, hey, there's no medication for you, Alicia, that's going to help truly bring your pigmentation back, but let's just try this. So I didn't like that, but now I'm so happy that we've advanced and there are new things out there on the horizon. So happy for the people who are at a place. And I like to tell people who are starting their vitiligo journey, hey, there are things that could possibly help you. They weren't there when I started my vitiligo journey, but let me help you try and get a cure, not a cure, but help you get on a path where maybe you can repigment your skin. So,
Beautifully presented, both of you. Thank you. Gabby, will you take us through a little bit of an overview on the coverage and kind of where things stand?
Of course. And again, thank you all so much for just sharing your stories and kind of speaking to the patient perspective here. I think that more than ever, as we continue to look into policy solutions and see how we may be able to address this issue both on federal and state levels, I think it's really important to keep the patient perspective central. So again, appreciate all of your comments, and thank you, Dr. Leo, for your expertise. If anyone has questions for the panel, go ahead and drop them in the chat, and I will get to those after this brief overview, but definitely want to address any questions. So let's just dive into the coverage landscape for Medicare and Medicaid. This will really be focused on JAK inhibitors, as Dr. Leo mentioned. As we know, and as Natalie alluded to, not every patient wants to be on a JAK inhibitor. There are other options as well, but this is just kind of looking at some of the newer treatments that we've seen come out and some of the access barriers that we have seen in Medicare and Medicaid. So as mentioned, while the FDA has approved these targeted therapies for both vitiligo and alopecia areata, we still have these outdated insurance policies for Medicare and Medicaid that continue to undermine patient access to care. So if we look at the Medicare side, while vitiligo is covered under the Medicare Part D prescription drug manual, there is specific language classifying it as non-cosmetic. That is not the case for alopecia areata. And so that means for patients with alopecia areata who are interested in seeking treatment, because said treatment may technically minimize hair loss, because of that kind of operational factor, it is not covered under Medicare, it's excluded. And so that causes a real issue for patients who are just seeking to get treatment that has been approved to treat their alopecia areata. On the Medicaid side, for both conditions, we see inconsistent coverage. For vitiligo, while there is guidance on the Medicare side, several Medicaid directors do not provide coverage for vitiligo. And, in a lot of states, there is coverage, and I'll dive into this a little more, but there's some of that, those formulary controls. So as mentioned earlier by Alicia, she kind of alluded to step therapy. And so that's like the fail first and having to try other drugs before you can get to the one that your doctor is suggesting and wanting to prescribe for you. And so this delays patient access. This means that, the progression of one's condition will likely be much more severe than it is initially, if they are able to get an early diagnosis. And it really just hurts patient outcomes in the long run. So we see step therapy, we see prior authorization, and other forms of utilization management, but I'll dive into that a little more. And then on the alopecia areata side with Medicaid, in most states, it is not covered. We have seen, and I'll pass on to the next slide here, that in California, they do offer coverage for Medicaid, under Medicaid for one of the JAK inhibitors, but in most states, there is not direct coverage. So based off of our research, in at least 30 states, there is no coverage for FDA-approved JAK inhibitors for alopecia areata. And if there is, it's usually for maybe one out of the 3 different JAK inhibitors, or there's going to be prior authorization, or it just isn't even on the formulary. When we look at vitiligo, we've seen a little more progress here. You can see on the screen that at least 11 states have excluded coverage for FDA-approved vitiligo treatments under Medicaid. So the states on the left side are those that have explicit exclusion criteria. And then on the right side, it's not as clear like written exclusion, but we have, heard reports of denial letters for patients who do seek treatment. And then I will note that 24 states have written coverage policies for vitiligo. But again, as I mentioned, those often come with additional formulary restrictions. And then in about 16 states, we've heard of coverage being offered, but there's not explicit policies. So that leaves, some uncertainty to patients because it really could be determined on a case-by-case basis. So our goal here with some of the policy solutions that I'm going to go through, we're really just asking for legislators and regulators to kind of step up and issue some guidance to ensure that that coverage is consistent and that these conditions are not classified as cosmetic. Because, as discussed, that's a lot of the underlying issue. It's just misclassification of these conditions and other skin conditions. So briefly just going to touch on the approach that we have been working on along with other DCAN members and a couple of congressional champions. As you can see, we are hoping to introduce legislation that will require Medicare to update their prescription drug manual for Part D to also classify alopecia areata as non-cosmetic. For background, this manual has not been updated since 2016. So it is time to kind of add some updates, reflect the changes that we've seen, and make sure that patients are not continuing to encounter these access barriers. And then on the other side, we are also asking if Congress can direct CMS to issue a health plan system memo, urging Medicaid directors to follow this guidance. So kind of like a little push from CMS to really urge some consistency here on the Medicaid level. And I'll, flag that we have been working with congressional champions, Congressman Hank Johnson. He actually lives with vitiligo, and Ayanna Pressley, she lives with alopecia areata, as well as Congressman Dan Crenshaw, who has been very supportive of this issue. And so we are still looking for other offices who may be interested, but definitely for anyone who is maybe interested, please do reach out to me or our Anish and Congressman Johnson's office, and I'll share that information in a little bit. I also wanted to flag that we are working to issue a Dear CMS letter from legislators urging CMS to do, what we're outlining in the legislation. This would really just add to the noise and the pressure and the push from really the skin community to make sure that these treatments are not classified as cosmetic. So, if anyone is interested, if your office is interested in joining this letter, look out. We will be circulating it within the next few months and definitely want to include your voice, your office here as well. So, as a brief overview, the call to action here is just to urge your Congress member to please support legislation addressing misclassification of FDA-approved treatments for vitiligo and alopecia areata. The key contact here is listed. Anish Nalla from Congressman Johnson's office has been super engaged with us and really helpful in helping us develop this legislation and push it forward. And then if you are interested in signing on to the Dear CMS letter, we will be circulating it soon, but please do reach out to me on the DCAN side, and I'm happy to facilitate that. So that's a brief overview of the policy solutions that we're exploring. I will take time now to see if anyone has any questions. Feel free to drop them into the chat. And then we can move on. So I'll give it a moment. I'm trying to see if I can see. Okay, let's see. So we have one question asking, could you speak a little about coverage for individuals under TRICARE and what DCAN is doing on this issue? So yeah, I'm happy to speak to that. And then of course, panelists, if you have any thoughts as well, feel free to chime in. So in TRICARE, we have seen the same issue for vitiligo and alopecia areata. And even though the VA actually issues a 10% disability rating for both conditions, the coverage is not fully reflected for TRICARE plans. So DCAN has actually submitted some language in this year's NDAA asking for that coverage to be updated under TRICARE. And we did actually include language really for all treatments. So it would also include, wigs for individuals with alopecia areata and not specified to certain treatments, such as the JAK inhibitors that we've kind of discussed today. So, we'll know a little later in this cycle if our efforts have been well received. But I will say we've also kind of just been circulating this with legislative offices that we've met with, and there hasn't been a lot of pushback. Everyone seems to understand that this is a real issue. I think there's just a lack of awareness about it. So I think, as long as we continue to do this work and really make some noise on this, hopefully we will see some progress soon. Anything else that you all want to add, Natalie, Alicia, or Dr. Leo? I don't see any other questions at the moment, but
I will say
I will
this.
say this.
I just want to, I appreciate everyone who's listening, but I just want to add, don't wait until it affects you or someone that you know to decide to, join in with us and helping, get policy changes, because it really, vitiligo and alopecia both can happen to anyone at any age. So don't be surprised, you turn and it could happen to you as well. So we thank you for those who are empathetic to, our stories and what we go through, but it can happen to any of us at any time.
Well said. Thank you. All right. So I don't see any other questions. Natalie, Dr. Leo, if you have any closing remarks you'd like to share. I see no from Natalie. But I just want to again thank everyone so much for joining today. Thank you so much to our amazing panelists. Really appreciate you all sharing your stories here and really speaking to this issue. And looking forward to how we can collaborate on this moving forward. So thank you all. Have a wonderful rest of your week.